During the recurring gathering of members of Armenian American health professional organizations, AAHPO's President Larry Najarian welcomed the attendees and thanked the board members for their tireless work and contribution to this vital Armenian health organization. After Dr. Louis Najarian read the AAHPO's mission, Dr. Kim Hekimian took the stage as the keynote speaker. Her highly informative and important slideshow presentation focused on various subjects concerning healthcare in Armenia today.
So we know that there's a great relationship between the health security and national security, right? So obviously we have to defend our borders. We have a military personnel that if they are unhealthy, they're going to be less able to defend the nation on the most basic level, right? But in addition to which, the productivity of the nation is dependent on a healthy workforce. And so we need a healthy and strong health system to reduce the vulnerability of the state to threats from other nations, natural threats, climate change, and diseases, and so on. So I want to illustrate this with two slides to show you the impact of COVID-19 and the war and the impact of the earthquake in 1988. This is what we call excess mortality. So this is mortality above which we would have expected given the trends of data for the prior 5 to 10 years prior to 2020. The green line here is the WHO European region. They experienced excessive deaths during the pandemic as well. But in Armenia's case, we're the red line here, you can see that the combination of the war and COVID-19, we had excessive deaths of 140 per 100,000 population because of the calamity, and that calamity overran a system that wasn't really resilient to that kind of threat. So what is the mortality trend in under 5 and under 1? These are considered the death rate of children under age 5 or the death rate of a live birth up to age 1 year of age. These are considered indicators that are proxy measures for the state of healthcare in any country. And you can see this is 1990 at the start of independence. And this is at the time that I lived in Armenia during these years consistently. This is when we launched the American University of Armenia's public health program. And you can see there was a lot of efforts put forth to reduce infant mortality, which was quite high at the time of independence. And it was high because of, largely because of infectious disease. I'm talking about post-neonatal mortality, so mortality from age 1 month to age 1 year. And largely due to infections, inappropriate treatment of infections, diarrheal, acute respiratory infections, and so on. And so at the time that we promoted breastfeeding, exclusive breastfeeding, at the same time the World Bank had given credits to change the water pipes and improving sort of a variety of environmental changes impacted the under 5 and under 1 mortality rate. And this is maternal mortality from 2000 to 2017 and has bumped up a little bit because of COVID. There were quite a few pregnant women who died or died in postpartum because of COVID. So it's gone up, but our hope is that it's going to come down. And this is an area of priority as well for the Ministry of Health. This is something I want to talk about. It's called the World Bank Human Capital Index. The World Bank creates, they have a number of different indices that look at the strength of the economy. And one of them is looking at the strength of the human capital of a country to reach its maximum productivity. And they look at various measures, and it's a sort of it's a measure that takes into account survival, it's health, education, and social protection, essentially. And so I'm most interested, obviously, in the health indicators, but I want to say that health alone, without changing education, is that none of these sectors work independently, and they can all be improved with each other. Human Capital Index looks at knowledge, skills, health, and social protection to maximize productivity in any given economy. Our HCI score in Armenia currently is 0.58. What does that mean? It means that a child born today in Armenia, on the average, will reach 58% of that child's potential productivity, and that number can go up if there are investments made in these areas of health, education, and social protection. Armenia's out-of-pocket healthcare expenditure is the highest in the world. So 84% of all healthcare expenditure in Armenia is out of pocket, is out of the individual's pocket. Now this is probably a reflection of diaspora and remittances back home for when people do have a health issue. They're probably taking monies in and spending that. But that's a reflection of how little the state actually contributes to healthcare, right? So Armenia's 84% of Armenia's expenditure here is this green level, this darker green, and then the lighter green is the state's contribution. This is something that the Ministry of Health wants to change and will change with the acceptance of universal health care, but it's still not going to go up that much. Right now, public spending is only 1.4% of GDP. And we're competing against defense budgets, education budgets. Everybody is garnering for a greater piece of the state budget, understandably so. But 1.4% is really low compared to other countries in the region. I was telling you about the burden of disease, and you can see pre-COVID, you can see the top 10 causes of death. These mirror the global trend. One difference in Armenia versus some countries that are comparable to Armenia's income is that Armenia's fourth leading cause of death is diabetes. And that's an indication of how poor the primary healthcare system is working as well. So diabetes is leading cause of death in many countries, but usually not in the top 5. This is a death rate from diabetes from 1990 to 2019. Armenia is the top here. Right, so there have been interventions in the early 2000s to try to strengthen the screening. Being screened for diabetes is free, and then there's new generation of generic metformin and other drugs to address diabetes. But still, our death rate in Armenia is much, much higher. Here's the United States, Europe, and Central Asia. But also just to show you that range, right? To show you that range. So we can do a lot better. So as I said, the top leading determinants of death in Armenia and and in the U.S. and many, many countries: high blood pressure, diet, tobacco, high plasma glucose, BMI, cholesterol, air pollution, which is terrible in Yerevan, and alcohol. So prevention is the best investment in health, right? So I just want to point this out. More than 5,500 Armenians die every year due to tobacco-related illness, accounting for 20% of all deaths in the country. And this is a similar number to how many people we lost in the war, right? Tobacco costs Armenia 273 billion dirham every year, which is equivalent of 4.2% of its GDP. This was in 2017. The diaspora has never, in any meaningful way, has never contributed to a nationwide effort, a campaign to reduce smoking. And we've spent billions of dollars on a lot of equipment that are helping a handful of people, but the largest issues we've never really jumped into, and I hope that we start to think about things more systematically and change that. On top of all this situation, Armenia's population is decreasing. The fertility rate is below replacement rate, so the average Armenian family is having 1.6 children, and so our population is decreasing, which for me means that it's even more important that every person reach their potential in terms of their human capital, because we're going to be having a very small population. So this is something that I think all of us know inherently, but early investments in human capital deliver the highest returns, okay? So prenatal care and age 0 to 3 up to age 5. Investments in prenatal care, early childhood, and preschool are going to have the largest return on investment. And in my area, which is in nutrition, that's absolutely true. And then of course school age and post school job training. So one of the issues that I really have is that policy that I see, at least, I don't see policy being made that's driven by data. And for people who are in my field, and everybody in this room runs their job based on the evidence that they have from the quality of data that they have. They have poor quality data or no data, they're taking a stab in the dark, right? I really, really want to keep utilizing the term that health security is national security. But talking about that at the highest level of the Ministry of Health, they're uncomfortable with that, which I find very interesting coming from the outside. I have not spoken about mental health, but mental health is extremely important. I don't play a role in that, but grief is a determinant of health, and everybody is grieving. There's not a single family in Armenia that hasn't been touched by a death or an injury in the war, or a death or an injury during COVID. I've learned that change at the community level can only come when the community is at the decision-making table before you've made your healthcare plan. And cultural competence and humility are absolutely a must. There's no way that you can go in and make change if you don't stop and listen first and learn the cultural context, the historical context, and then be humble. Be humble. Because if you can imagine yourself, you all are working here in the United States, and you have been told that your training is top in the world. And imagine somebody from another country comes out and says to you, no, you're doing everything wrong. Everything you're doing is wrong. You would be defensive. You would tell them that they're wrong. You wouldn't be able to just accept that and say, okay, I'm going to see a new slide and I'm going to change clinical practice because of your slide. So just think about that psychologically and ask why. When you get on the ground, ask why is something happening? Because we, right, Chris and Ani, all of us, when we're on the ground, we see something happen, we go, oh my God, that's so terrible. But ask why. Why is it happening that way? Because it's not happening because people are just mean, or people are just, it's happening because that was how they were trained. That's the cultural norm. So I'm hoping that we can continue this partnership and expand it. And I'm hoping that the diaspora, as they put together their programming, that they fit it within the strategy of the government's priorities, which is to increase coverage, improve primary care, and improve quality of care. Thank you.
AAHPO and its members continue their important mission to serve the healthcare needs of their compatriots in Armenia, US, and beyond.